Welcome to this resource on understanding pleurisy. We'll cover some important information as well as 5 practice questions at the end that you might see on exams. But first, let me welcome you to Artemis Interactive Media. Artemis is your guide to learning resource supplements and content overview for continuing education. This quick timeout is a short study break and we'll cover understanding pleurisy. But don't worry, if we need help, Artemis will be here to guide us. Pleurisy is inflammation of the pleura. The pleura are membranes surrounding the lungs. This causes pain during breathing and may occur with infection or lung disease. Inflamed pleural layers rub together. Friction causes sharp chest pain, and the pain worsens when deep breathing. Breathing may become shallow. Signs and symptoms include sharp chest pain, shortness of breath, a dry cough, and fever if infection is present. Causes include viral or bacterial infections, pneumonia, pulmonary embolism, and autoimmune disorders. Diagnostic tools include chest X-ray, CT scan, blood tests, and respiratory assessments. Complications may include pleural effusion, difficulty breathing, atelectasis, and chronic pain. Medical treatment may involve administering pain medications, anti-inflammatory drugs, treating the underlying cause, and encouraging deep breathing. Nursing care includes monitoring respiratory status, assessing pain level, promoting lung expansion, and encouraging coughing and deep breathing. Patient education may include taking medication as prescribed, avoiding smoking, reporting worsening symptoms, and practicing breathing exercises. There are some key takeaways. Pleurisy causes painful breathing. The treatment targets the underlying cause. Pain management improves breathing, and early treatment reduces or prevents complications. Remember, pleurisy can be difficult to understand because symptoms may be similar to other respiratory illnesses. Generally, positioning for clients with respiratory issues include elevating the head of the bed to facilitate better lung expansion and gas exchange. A client with pleurisy may be positioned on the affected side to splint the chest and ease discomfort. Pleurisy can be a complicated topic to understand. Different respiratory conditions require different treatment considerations. The following questions will test your knowledge on the material we covered in this resource. Please answer the following 5 questions to gauge your mastery of the material, and don't worry, if we need help, Artemis will be here to guide us. Question 1. A nurse is teaching a client about pleurisy. Which statement best describes this condition? A. Inflammation of the pleural lining surrounding the lungs. B. Infection of the heart muscle. C. Collapse of the alveoli only. Or D. Obstruction of the upper airway. Artemis is going to help us and tell us that it's A. Inflammation of the pleural lining surrounding the lungs. Can you give us some rationale? Pleurisy is inflammation of the pleura, which are the membranes surrounding the lungs. Thanks, Artemis. Question 2. A nurse auscultates a pleural friction rub. How should this finding be interpreted? A. Air trapped in alveoli. B. Inflamed pleural surfaces rubbing together. C. Fluid in the pleural space. Or D. Bronchial constriction. I'm going to say B. Inflamed pleural surfaces rubbing together. And Artemis says we're right. Can you give us some rationale? A pleural friction rub is a grating sound caused by inflamed pleural layers rubbing against each other. Thanks, Artemis. Question 3. Which position would best help relieve pleuritic chest pain? A. Lying on the unaffected side. B. Sitting upright and leaning forward. C. Lying on the affected side. Or D. Trendelenburg position. I'm going to say lying on the affected side. C. And Artemis says we're right. Can you give us some rationale? Lying on the affected side splints the chest wall and limits pleural movement. That helps reduce pain. Question 4. Which intervention is most important when caring for a client with pleurisy? A. Encouraging complete bed rest indefinitely. B. Monitoring respiratory status and oxygen saturation. C, restricting all movement, or D, avoiding pain medication? I'm going to go, B, monitoring respiratory status and oxygen saturation. And Artemis says we're right. Can you give us some rationale? Pleurisy can affect breathing and oxygenation, so respiratory assessment remains the priority. Question 5. Which medication would the nurse expect to administer first for uncomplicated pleurisy? A, antibiotics, B, diuretics, C, antifungal medications, or D, NSAIDs? Well, pleurisy is inflammation of the pleural lining. It can be caused by infection, but this is uncomplicated pleurisy. So I'm going to say D, NSAIDs. Did I get it right? We did. Can you give us the rationale? Artemis says that NSAIDs reduce inflammation and are the primary treatment for pleuritic pain when infection is not the direct cause. Thanks, Artemis. Thank you for your attention to this resource provided by Artemis Interactive Media. This presentation may be used for content review and clinical competencies for pre-conference and post-conference education. This quick timeout can also be used for a short study break. Pleurisy involves more than this QT covers, so for more information on this disorder, please contact your instructor and refer to your textbook.